So this video is particularly for people with early stage interstitial lung disease or lung fibrosis. And the video is not going to give you any specific information about your type of ILD or fibrosis. There's not going to be any details here about possible treatments. It's just more general, holistic advice, but I think you'll still find it useful. So my name's Ruth Aldridge. I'm a respiratory consultant, and I've developed a particular interest in helping people with their lung disease globally, holistically, looking at the symptoms and trying to improve the symptoms and quality of life. And we've set up the fatigue and breathlessness group, the FAB group or FAB course, and that's for people with quite severe lung conditions. But you may have an early stage of lung disease, lung fibrosis, and this video is for you, and we're really focusing on what you can do to help yourself. Right now you might be feeling quite shocked and a bit stunned. One of the doctors may have just told you about this lung disease, and you're just wondering what the future holds and what the implications are for family life, your work, even your finances. Or it may be that some of your hobbies focus on activity. You may play badminton or cycle, and you're wondering, is this going to impact on them? And then somebody might have suggested that you go and see someone to discuss palliative support, and that might really have got your alarm going. And that's understandable, because this diagram here shows the traditional model. And as you can see along the bottom, the left-hand side it says diagnosis, on the right-hand side it says death. And really that's looking at the time, going from left to right, from diagnosis to the end of life. And traditionally, people just focus on treatments that are aimed at curing or improving, prolonging life, first of all. And only when you get towards the end of life do you go for palliative care. And so understandably, if then somebody tells you you're going to see somebody for palliative care, you might get a bit worried. I must be at the end of life right there. But that's not actually the case, because these days it's this bottom model that we use. And you can see that active treatment, that's sort of curative and treatment to try and prolong and stop diseases getting worse, starts right from the very beginning and continues throughout. But at the same time, palliative care, focusing on symptoms and quality of life, starts early on, right at the beginning, and carries on and gets more important, as you can imagine, as disease progresses. So what can you do right now sort of to help yourself for immediate benefit, and also to help in the future if things get worse? We don't know whether things do get worse. Sometimes interstitial lung disease and fibrosis progresses over time, sometimes it doesn't. So these are 4 things that you can do and learn to do now that are going to help. But before coming to those 4 things that are written down there, I just want to tell you a little bit about the FAB group, the fatigue and breathlessness group, because all the strategies and ideas that we're going to discuss here are also discussed on the fatigue and breathlessness group. It's called a group because commonly we do meet as a group round a table, and obviously there are some advantages to meeting as a group, but all the information is now available electronically or in paper handouts and on videos. So you'll be able to get all the information even if you're just looking at this by yourself. Now, as I mentioned before, the FAB group is for people who have got advanced, severe lung disease. They're finding it difficult just to walk around the house and do things around the house, or they struggle a lot around a supermarket. And these are the sorts of things that we discuss on the FAB course. We obviously talk about breathlessness and fatigue. We talk about stress and anxiety, depression, oxygen. We talk about maximising life. We talk about supporting other people involved, the carers or spouses. And then we also talk about, if things get worse, what might happen. We plan for the future a bit. So this is all aimed at people with advanced respiratory disease, and that may not be where you are right now at all. And if that's the case, then you'd be much better off, in a way, going to what we call pulmonary rehabilitation. And the pulmonary rehabilitation group focuses particularly on exercise and keeping fit, but it also gives people a lot of information, and that's for people with less severe lung conditions. So for FAB, we give an awful lot of information and encourage exercise, but there's no specific exercise program involved, whereas the pulmonary rehabilitation is all about focusing mainly on the exercise, which is done as a group normally, although it can be done at home individually, and then there's some information as well. So in FAB we've got videos, as I've mentioned, and they're divided into 3 different videos. Video 1 on breathlessness, 2 focusing on fatigue, and 3 living life to the max. And we've got 2 different versions of each, one long and detailed, and one that's meant to be short and snappy, but isn't that short and snappy just because it's got so much information to get across. We've also got handouts, and you can download those from the Impact Plus website and elsewhere. And again, just be aware that the information in the FAB handouts are for people who are struggling with normal daily activities. I just don't want you to think, good grief, this is definitely the way I'm going to go, because it may not. Your disease may not pan out like that, but there's just such a lot of information in there. I think you'll find it useful. So, what are these 4 things that you can do to help yourself right now? Well, the first is learning about symptom control. And there's a lot of different ways that you can control breathlessness. But one of the main ways that I would suggest that you focus on right now is learning how to do diaphragmatic or tummy breathing. It's quite difficult to learn diaphragmatic breathing if you've got advanced lung disease and your breathing's really difficult. So if you're at the early stage, this is the right time to learn to breathe like this. And there are 2 different ways that people tend to breathe. One is with the upper chest, and one is with the lower chest, with the tummy or diaphragm. And breathing with the lower chest is far more efficient. It doesn't take up so much energy, but gets lots of oxygen in. Whereas breathing from the upper chest isn't very efficient. It uses up a lot of energy and only allows a little bit of oxygen in. And the problem is that once you're breathless, often the breathing pattern alters and becomes increasingly more from the upper chest. So you might want to just shut your eyes now and work out which sort of type of breathing you do. Just shut your eyes and take a few deep breaths in and out. You might notice right now that you're breathing using your upper chest or your tummy, or you might not be sure. One way to help you work this out is to put one hand on the top of your chest where a sort of a necklace or the tie would be tied, and the other hand just at the top of your tummy, just above your belly button. And then shut your eyes and take a few breaths in and out. And work out which hand is moving more. So, if when you take a deep breath in, you feel a bit taller, if your shoulders rise up a bit and you can feel your upper chest expanding, then it's very likely that you're using upper chest breathing. But if when you breathe in, it feels as if your lower chest is expanding more and your tummy goes out, then you're using diaphragmatic breathing or tummy breathing or belly breathing, as this diagram calls it. And why belly breathing or tummy breathing, diaphragmatic breathing, is so much better is because the diaphragm is a powerful muscle, it's very efficient, and it doesn't tire. Whereas the muscles at the top of the chest are called accessory muscles, and they tire much more quickly, and if you use them the whole time, they become very stiff and sore. This is a picture of a lady lying down, and as she takes her breath in, the hand on her tummy goes up, and as she breathes out, the hand on the tummy goes down. And often when you're learning to do diaphragmatic breathing, it's quite helpful to be lying back, not necessarily as flat as this lady, but sort of back in the chair, in a recliner chair, or in bed. You'll find that an easier way to focus on the tummy. Often people talk about the 3 R's of diaphragmatic breathing. The tummy rises up as you breathe in, and then as you breathe out, the tummy just relaxes and goes down, and then there's a period of rest before you take the next breath in. Rise, relax, rest. There's a very good video on YouTube of diaphragmatic breathing. It's an American video, and all you need to do is put into your search engine diaphragmatic breathing Michigan, and it'll come up with these 2 ladies here. I think they explain it very well. So, one of the key things if you've got a sort of early stage interstitial lung disease is to try and alter your breathing to diaphragmatic breathing. It's not going to happen overnight. You have to practice it each day, several times a day, and bit by bit your breathing will change over. But there's lots of other strategies that you can use to relieve acute breathlessness. If after exertion you get gasping for breath, you can control the breathing better with a number of techniques, and we're not going to go into them here. I'm going to list them, and if you want more information, then you can look up the information on the FAB site. So you can learn to slow your breathing down. That helps, because when you're gasping for breath, you're breathing too fast. So taking slow breaths in and out is a very good idea. It's acknowledged that unfortunately severe breathlessness automatically sets off a bit of panic and anxiety in the brain, so just to be aware of that. Some people find reassuring, otherwise they don't know why they're going a bit anxious. Another tip is to breathe in through the nose and out through the mouth. It's all explained in detail on the videos and in the handouts. Something that people find very useful is this breathing round a rectangle. I won't say anything more at the moment. And there's a poem that some people find helpful. And I think using a fan, I can think of one gentleman who literally a couple of days ago told me his life has changed since he's realised how useful a fan is. He says it's far more useful than his oxygen. And then you can try different medication, particularly oxygen. It'll be very helpful, more helpful than a fan for some people. And then there's other types called Oromorph and lorazepam, which are liquid and tablet medication. So that's all about learning about symptom control. And as I've said, I think the key thing is to see if you can train yourself to breathe from the diaphragm and tummy at this point. That would be really helpful. But I think even more important than diaphragmatic breathing is this next one down, keeping as fit as possible. If you have a lung problem, you need to make sure that your heart and your muscles are functioning well, that they stay trim. And this diagram explains that. So it may be that you've started to notice breathlessness when doing things. Maybe when you're cycling up a hill, or when you're vacuuming, maybe when you're playing badminton, or just lifting heavy boxes, you get breathless. And so what do? Well, there's a tendency to avoid those activities, and so you tend to do less activity. And that sounds good because you're getting less symptoms, but of course that means that you're not exercising your muscles so much, and your heart isn't exercising and will become deconditioned. This in turn means that the body isn't as efficient at doing things, and you'll become more breathless and more fatigued and exhausted as a result. And of course that'll mean that doing activity causes more breathlessness, and you'll want to do less activity, and so you'll get into this vicious cycle where you become weaker and as a result more breathless. There is of course another option, but it's a difficult option. And that's this cycle on the right hand side of this page. And you could, if you wanted, you might decide that despite it being awkward, despite you feeling like it's a struggle to breathe, you're going to push yourself to do more activity. And of course, by doing that, you're going to get stronger muscles and a fitter heart. And this will rather paradoxically mean that you are less breathless in the future and that you've got more energy and less fatigue. And so that will encourage you to do more activity. So if you follow this path on the right hand side of the page, you'll find that you actually get stronger and you experience less breathlessness. So I think the important area in this chart is this area that I've highlighted with the red arrow there, because it's which way are you going to go? Are you going to choose to do less activity or more activity? And of course it's up to you. But I think the arrows there aren't right, because they are equal size, and that's not the way it is. It's much easier to go towards that left side, towards the less activity cycle there, and much harder to push yourself to do more activity. But as I say, it's your choice, and I think it's difficult. I'm not saying that it's easy to get into this more activity, let's keep your fitness up cycle, but I know that it's really good for you. And it just reminds me of that old phrase, use it or lose it. So how would you do regular activity and exercise? Because that's what we're after, regular activity. If you just sort of push it for a few days and then stop for a few weeks, it's not going to do any good for you at all, really. And as I mentioned before, the pulmonary rehabilitation group or class is, I think, the best thing. It's called the gold standard. People get really amazing results going through this program. They sometimes double the distance that they can walk in, for example, 6 minutes. The program takes 6 weeks to go through, and you attend twice a week. So that's 12 sessions all in all, and you're given an individualised exercise programme. So there may be other people in the group who are slightly fitter or less fit than you. Probably, if you're still pretty good, you'll find that you're one of the fitter people in the group, probably. But it's individualised to your circumstance. And then after you've done the exercise, which I think lasts about sort of 40 minutes or something, you have a quick break, and then there's some sort of talk with an educational programme in, which is very good. Now, if you do the 6 weeks and you really work at it, then almost certainly you're going to get some really good results. But it's so important to continue on after that. You can't just do the 6 weeks and call it a day, because within 3 months you're going to go back to where you were to begin with. So it's really important that you do something ongoing, and there are often maintenance classes that you can attend once or twice a week. And those are very much recommended. Sometimes people can't attend in person, and there are virtual online exercise groups that you can join and various handbooks. There are very good exercises on the British Lung Foundation website, and you can find them by searching for British Lung Foundation Stay Active, Stay Well. But of course you don't have to do something structured like that if you don't want to. You could just think about walking the dog regularly, or going dancing, doing lots of gardening, something just to keep active regularly. But if I'm honest, they're not going to have the same impact as doing structured exercise, which focuses on both aerobic exercise, that's keeping the heart fit, and also weight and resistance training, that is building up the muscles. So that's the second thing that I'm suggesting you might want to consider doing right now. And the third and the fourth item on this list, they're really together. They're looking at your general well-being, your mental and emotional health. And that's so important, because we now know that that really has a big influence in your lung disease. So first of all, I just want to mention the NHS 5 Ways to Wellbeing. We're not going to go into any detail here. They are detailed in the Fab group. But the NHS has spent quite a lot of time and money working out how you can stay happy and content, even if you've got a severe health condition. And these are the 5 ways that they have found from research really help. Connecting with other people in a significant way, so not just having contact with people, but having a really good relationship with people. Continuing to learning new things. It doesn't have to be something serious like Open University, just learning new things each day. Staying active. By doing activity and exercise, you're releasing those endorphins which improve your well-being. Stopping and reflecting and taking notice on things, and giving out to others. All these 5 things have been shown to improve well-being, and there's lots of literature online. You can do a Google search for this one that Devon has put together. All you need to do is search "taking steps towards living well Devon," and you'll be looking at that PDF document, which is very good. So that's the NHS 5 ways to well-being. But it's just so important to try and train your brain to think as positively as possible, because this really influences your physical health. And there are 2 ways that I think your brain can influence your lung disease, really. First of all, we know that ongoing stress and anxiety makes breathlessness worse. And we know that regular relaxation and mindfulness can reduce breathlessness, and this diagram explains that. Now, you may not be getting really severe breathlessness yet, and you may never get to that stage, but people who do experience sudden breathlessness that's really extreme, their brain reacts in a fight, flight, freeze response that you might have heard of. It's as if an internal alarm system is going off in the brain saying danger, danger. And as a result, there are various hormones and nerve impulses that go around the body, and that causes almost inevitably an element of panic and anxiety. But one of the responses to feeling panic and anxiety is to breathe more rapidly, and that increases the sensation of breathlessness. So you're in one of those vicious cycles where, if you're not careful, having got breathless, it's very easy to continue to feel breathless for quite a long while because of this internal alarm system that has been triggered. And what would be great is if you can stop the internal alarm system going off, or if you can just minimise the alarm level that goes off. And it's been shown that relaxation, and particularly mindfulness, can do that. So they did MRI scans on people who, before and after an 8-week course of mindfulness, people only had to do 10 minutes of mindfulness each day. And interestingly enough, after the 8 weeks, the brain's alarm system, called the amygdala, had reduced in size and activity. So that just shows that doing mindfulness can stop this vicious circle going on. So that's why I've highlighted there the importance of regular relaxation and mindfulness. But it's interesting because regular relaxation and mindfulness won't only help breathlessness, it'll also help us all. It will help us not overreact to things that are happening. Sometimes we overreact by becoming angry or aggressive. We sort of have an outburst towards something or somebody. Or at other times we react by being really upset or getting depressed. And by doing regular relaxation and mindfulness, your intense reaction will be minimised, and so it will have a good knock-on effect, not only for your lung disease, but for your whole life in general. But the other thing that I want to highlight here is if we look after our brain and reduce the stress and anxiety that we feel on a day-to-day basis, that helps us with our general physical health. Look at this list here of things that stress causes or worsens. It causes the immune system not to work so well. It causes increased respiratory tract infections like coughs and colds. It worsens asthma. Ongoing stress increases your risk of heart attacks, high blood pressure and strokes. And if you've got cancer, it increases your chance of cancer progression. I just want to highlight this by telling you about a study that was done quite a long while ago now, and it took healthy people. They were healthy people who were caring for people with Alzheimer's, and the idea was that they were probably under considerable stress because dealing with somebody who's got Alzheimer's dementia is very stressful. So they took 13 people who were carers for people with Alzheimer's, and then they chose another 13 people who were healthy. They were the same age as the people caring for Alzheimer's, but they weren't carers, and so they weren't thought to be under the same stress levels. And all these people were given a skin punch biopsy, which I'll show you in a minute, and then they were just monitored, and the study looked at how long it took for the skin biopsy wound to heal. This is what a skin biopsy looks like. You sort of stick that little green thing in the skin, and it sort of cuts out a little round cylindrical shape, and normally you stitch it up like that, but so that it heals quickly. But for this study it was left open, and it shrunk gradually over weeks. And these are the results here, and basically the bottom line is the people who were stressed, it took them far longer for their wounds to heal than the people who weren't stressed. And at 5 weeks, for example, only 16% of the stressed carers had healed their wound, but 47% of the relaxed controls wounds had healed. So that just shows the impact that stress can have on a physical wound. And I think that a lot of people just aren't aware of that, and so they're not aware of how important it is to look after your brain. The FAB literature has quite a lot of looking after your brain. The week 2 FAB talks a lot about relaxation and mindfulness, and the week 3 FAB talks about how you can, if you want to, look at your thoughts and feelings and change them to give yourself a slightly more positive outlook on life. It's called the hot cross bun method. There are also some very good apps available online for your mobile phone or tablet. There's one, these two are recommended by the NHS. The first one, Feeling Good, is an app that I use. It was originally devised for Olympic athletes in Sweden, and is used an awful lot in Scotland now, so you'll hear a Scottish voice on that one. And then the Daylight app is particularly helpful if you do have a degree of worry or stress. The Feeling Good one is for anybody. It just helps develop a positive mental training program. The Daylight app is particularly good if you have a tendency to worry and stress. There's also a very good website called getselfhelp.co.uk. It's got an awful lot of information on there. So those are then the 4 things that I think you could consider doing now if you want to help yourself. First of all, learn about symptom control and see if you can change your breathing to diaphragmatic breathing if at all possible. Secondly, keep as fit as possible. And then thirdly, and I'm lumping these 2 together because they're both to do with the mind, focus on improving your mental health and general well-being. Anything else, you say? What else should I do? Well, I think it's quite good to build up a support network around you. You don't want to just rely on help from one area. It's better to have a whole group of people involved, and then it's easier to get help if need be. So obviously you've got your GP practice. There may be peer support groups locally. In Derby we have Impact Plus, and then you've got your hospital consultant and national support groups such as the Action for Pulmonary Fibrosis or the British Lung Foundation. In Derby, we have the Derby Pulmonary Fibrosis Support Group that meets monthly, and often people tell me that it's just been so helpful to go. I think the British Lung Foundation site is amazing. I wasn't aware until recently that it covered so much, but I would very much recommend you look there. So this is practically the end of this video, and I just want to share with you a couple of take-home messages. I guess having a diagnosis of interstitial lung disease or lung fibrosis can be worrying, because the future is uncertain and life may change, and that's really difficult. And what I would suggest is you try and focus on today and enjoying today, because none of us know what the future looks like, and of course we can't do that much to influence the future, whereas we can do things today. The other thing to note is that some people with interstitial lung disease find that their lung disease doesn't progress and that it's stable, so you may never get to a stage where you've got a severe breathing problem. So again, you don't want to focus too much on that, because you may never get to that stage. And then the other thing is that there are definitely things, as we've highlighted, that you can do to maximise your physical health and mental fitness right now, and those things are going to make a difference. Probably they will make a difference to you and actually to the people around you. And then the other tip I would say is make sure that you develop good links with your local health team, the specialist nurse, consultant and your GP surgery. And in Derby here, the Impact Plus has a lung line which you can phone 7 days a week for advice or queries if you want to, and the number is there. So I hope this has been useful to you. There's lots more information in the FAB handouts and videos, and of course you can get specific information related to your specific lung condition from your local health team. Thank you.